Good. Good.
Brass.
Good. Good. My shoulder's gonna drop. That's it. Good fall. This is Dr. Warren Kalkstein here at Kalkstein Chiropractic. Today I'm with Roman, and Roman's been coming to see us. Actually, you were referred over from a good friend of ours. Let's do a shout out to her. She deserves it.
Yeah.
Where is she? Is she in Bel Air?
No, she's right here in Stoneleigh on York Road. Allie Smith from True Balance Studios.
True Balance Studios.
Yeah.
And also shout out to LifeMed. They're
and also LifeMed. Yeah, everyone is healing me in this area over here. It's a triangle of health.
So if you're local to the area, Kent at LifeMed's awesome. I actually got to meet him and just kind of see his team, and one of his PAs that we know as well, Dan, is amazing, good person. They do good work over there. And then shout out to Allie Smith, and I actually met Allie through the office a little bit, as well as through her husband Jason, who's a firefighter out of Montgomery County, who we just did a fundraiser with. So a little bit of a small Baltimore world. That's like the last video that I did was with her husband. And she runs a great facility over there and does good work. And so we're working in conjunction with her and getting him back onto his fitness goals. Roman, that is. Okay, so Roman, what kind of brought you over to see us? And then I really have been enjoying my time with Roman for a couple of different reasons. He makes a big impact in our community in a positive way in terms of the work that he provides, but also he's just gotten to know the world of let's just call it conservative medicine here in Baltimore and the community. So a lot of people say this is alternative therapy,
Yeah.
And I really think that's just a weird way of describing what like true holistic health should be in people's lives. I think it's truly like the mainstay. It should be the foundation for good health, good body work, good movement, and chiropractic and massage can be a really good conjunction as it relates to that. Fitness and strength training. We talk about good supplementations. LifeMed does a good job with that as well, from that side of the coin. And then fitness, right? So I think that you know that community well. And so tell me how you kind of came this way.
So I I lived a very active lifestyle, and I've actually had chronic issues with my shoulder, and it culminated in me getting frozen shoulder about 2 years ago. And since then I've found it very challenging to sort of get back into my body and get the strength back. And I feel like right before I came here I was basically at the bottom of my level of sort of strength and posture and everything else. And I've been seeking every which way I can find to get back into it. And I've been training with Allie, and she recommended that I get a chiropractic adjustment. She felt like there were things that were not aligned, and immediately after the first session I felt the benefits, and I think the functional strength training here has also been a huge help. My previous experiences with chiropractic adjustments have been that the benefits are short-lived, but I feel like in combination with the functional strength training, it really helps me hold on to my posture and just keep getting stronger every day.
Nice. I love the way you describe that in terms of, and this can be the case as it relates to changing function in a tissue. So chiropractic care can get you so far. So manipulation, I talk about opening up a window or a catalyst for better motion in the segment. If we're not doing anything on our own or with the conjunction of a team and structure like we fortunately have here, then it sometimes can feel like that's short-lived with pain and with sometimes some types of, let's call it more neurological central issues. Adjustments can be more lasting, okay? But when I'm talking about biomechanical function of a segment or a group of segments, or the shoulder girdle as it relates to the mid-back, those type of things like we're working on with you, that takes a lot of other different inputs to take long-lasting, takes time to make those long-lasting changes, if you will, okay? So I hope that makes sense. Now adhesive, you mentioned frozen shoulder or adhesive capsulitis. That's a really, really significant diagnosis, and I'm just going to put it this way. In order for you to get from point A to point B with your hand to here, when you have that, a lot of times you're doing this because you literally cannot raise your arm up. And that's on the back end. So what I'm dealing with is like kind of the aftermath of frozen shoulder with Roman, okay? thank you for explaining that and sharing that. I'm going to show you how I work on Roman now, okay, and how I work on some of those areas. And just going to circle back on these two. Kent at LifeMed, a wonderful source of healthcare in our community, and they run a great organization. They're very, very experience driven, and I love that, and I met their team. They're great. And then Allie Smith, in terms of finding somebody in the community that has been giving into that community of fitness for a really long time, I know the family, and I could just attest to that personally, that I would trust that group of people to help you get your strength goals and to find a community. That's so important. So back to you, Roman. Let's get you feeling good, man. You put some work into that.
I did. I'm sweating here on this video. I had over an hour of strenuous exercise, but I feel great. I'm grateful for the opportunity.
Yeah, I love it. You can come get face down. Don't worry. We'll get this table cleaned up for the next person afterwards. Just get comfortable there and relax. We're going to focus on some of the mid-back muscles first. So my focus is to get better biomechanics here, okay? And then a result here as well. All right, so when I work with Roman, first I'm going to focus on these muscles that run down his mid-back, okay? We call them the erector spinae muscles. There's different levels to them based off the region of the spine, and there's different areas to them as well, and they're named after the regions that they kind of cover, if you will. So when I work with him, my thumb is doing this to his mid-back, and then I'm going to incorporate motion along with it. So you want to talk about conjunction of care, like a nice synergy of different things coming together to get you feeling better. ART is the form of soft tissue technique that I do. Fitness, strength training, and functionally based, not using machines, using free weights and giving good cueing, good positioning, good breath work, good stabilization prior to getting adjusted. And when you do that, it's money. You move so well on the adjustments. Reach your right hand above your head and reach up tall for me, okay? And so I'm going to elongate that tissue, and I'm going to push and drive through it, and I'm going to use my whole body to move this. This is intense, so I just usually have people breathe through it like that, nice and slow. Back down. Right hand here. Reach across, up and over. So we got Maddie behind the camera today.
Hi.
Madison is coming up on her 90-day review. Her probation is over.
My probation's over.
Hand back down here. And reach again for me. And today we're going to discuss with Madison, as she goes through her review, where she wants to take her next goal from a health standpoint. I really find it fortunate that I get to be a part of so many people's lives like Madison that are going through this kind of transition phase and jumping into the healthcare world. And a lot of different paths for people. I'll go through the list in my head. I'm gonna probably fall short on this one, but
Go ahead.
Let's go with Bree, PA school, Braden, PA school, Brooke, AV chiropractic school, Agnes chiropractic school, Rach. Okay, easy. Madison, she's going to like 15 different schools. She's going to be a
And it's
nurse.
never going to stop. I'm always going to be in school.
She's going to be a nurse. She's going to be a psychiatric nurse practitioner. She's going to be a therapist. She's going to be a chiropractor. I don't know what degree has all those things. Maybe you just go get your MD.
An awesome degree.
It's an awesome degree. You just started a new school.
I was going to say, she's blazing her own path.
Let's go. Good. That's the truth. Here you go. Reach. Good. And Madison, how did you find our office as an employee?
I wasn't a patient.
You were.
I was a patient before.
What did I say to you on your second visit here? Relax your arm forward.
You're like, why don't you come work here? Immediately. Why don't you come work for us?
Yeah. She's that
We'd
kind of
love to
person.
have you.
Truth.
I was like, okay.
And then you didn't come work here.
I didn't come work here for a minute. It took me a few months. But I got here, didn't I? I'm here. Coming up on 3 months. Or no, I'm at 3 months.
I shot my shot and I missed, but then it came back and it was it worked out. No,
Yeah, I came begging.
no, not even close.
I know.
Reach that right hand up for me. Good, grateful to have you, Madison.
I'm excited to be here.
And let this
It's been
shoulder
so
blade
fun.
drop. Breathe in. Let the shoulder blade drop this way for me, Roman. There you go. And I'm gonna work that spot right there. I am putting probably about, I'd say 40 to 50 pounds of pressure through my thumb when I work that area on that. I wouldn't do that to Roman on my first visit, nor would I do it to everybody. It's just the case dependent, okay? So, I just saw Bill in the other room. Bill's 87, he wants to play golf. And I'm not doing this on his mid-back because he's not ready for something like that. He hasn't worked up to a point like that. Right? Roman's been very proactive with his health through yoga and fitness. And so I'm able to just kind of take it up a notch in terms of trying to make a change in some of these areas. That feels good in here, Roman. So I'm palpating the rib heads as I come down. And I'm seeing how they glide in that position. And so I feel that. Settle here. There you go. It's good. Deep breath in. And exhale, relax, keep relaxing. Good. Good. Deep breath. Let the table drop. Lift your chin up for me and then just hang out there for a second. Exhale, loose. Good. Settle, settle. Good. So I just kind of wait until I get openings like that with him. Good. Good. Yeah. Perfect. So. Turn your head all the way to the right. And settle your shoulders. Good fall. Reach your hand overhead. Different muscle group. Good. Back down. Reach. So I'm pinning with my left elbow and I'm pushing with my right hand. Good. Reach. Now I'm going to roll into his rotator cuff. It's Terry's minor and major. Good. All good there. Okay. Yeah, your right side joint. Okay, come on your left side, right side up. Roman, what was your first job you had?
First job I had.
Very first.
The very first job I had technically was in a refugee camp in Italy.
Mm-hmm.
I was putting together bikes and selling them to the people in the community.
Oh,
And it was
wow.
a job, but you know.
Oh yeah, making the money.
Yeah.
Getting the job done. That's right. So you told me that story. Then, how did you learn that skill?
My dad is an engineer, and I grew up always watching him putting things together. So somehow I figured it out on my own. I mean, you know, with my father raising me, but at the time I was by myself. Well, he was cutting grass.
Good. Good. On
He
your
was
back.
cutting grass for an Italian man who then figured out that he was an engineer with a master's degree. And and asked him if he could help him, with his drawings and things.
He got a good deal out of that, didn't he? That Italian man.
He did.
So did that lead your dad to getting work elsewhere, or it just pushed him more into his career?
When we came to the States, he didn't have the computer skills and the language to work as an engineer here. So his hobby was jewelry his whole life, and he got a job first repairing jewelry and then making jewelry, and then eventually with his labor bought the jewelry store from the people he worked for.
That's amazing.
Yeah.
Love that. I just worked on this morning a first generation American. He's I don't know, actually I don't know how that's supposed to be worded, but basically
He was born here? Or?
Second generation.
Yes.
No, he's first. No, he is truly Italian.
Okay.
And his son is first generation American. Thank you. And so he's from Sicily, but he just went back, and I think he's 87, 89.
Yeah.
He went back for me and was talking to me about the nightclub that he owned in Baltimore on Eastern Avenue, and how he built himself up over the course of a certain amount of time, and just the relationship. So he's like, I love those stories of just like perseverance and getting it and putting yourself to the test and applying yourself, right? I think if I can harness that energy towards what I do, as well as just inspiring others to make it happen in their lives personally through their health, people will be a lot healthier in this country.
Yeah, results are 100% intention. From the way I work, I see you know that.
Yeah, that's the truth. So what made you want to build a bicycle?
Free time and bicycle parts.
You saw the opportunity,
I actually didn't think of selling it until I just built it and rode it around until someone said, hey kid, I'll give you some money for that bike.
Yeah.
And then I was like, I know where I can get more parts.
I'm gonna make this happen. That's amazing. Easy. Loose. Take a breath in for me. Good. Do not take our freedoms for granted here. We can focus on a lot of other things. Come on your back. When I worked at a hospital in DC, I did a 6-month rotation just out of school at a Walter Reed hospital. I was just fortunate because my father was a naval graduate and just having those connections, but just kind of made it happen, right? And so I stayed with a Ukrainian family that moved here back in the 60s, that were originally from really, I guess, Soviet area time. So they escaped communism through Italy and flew to the States.
Yeah, that was our story.
They worked through the Department of Defense, and I just got to learn so much from them. But I also, through this is 5 years ago, she was sending everything she made on Airbnb from me to support her family back home.
Yeah.
It's pretty cool. And this guy was such a legend. I don't even know how high up he was or where he was or what he was doing, but he would do he would do these ice baths in the middle of the winter because it's very common in their culture. And so it'd be snowing out, and I'd see him put his bathing suit on. I'm like, yo, where are you going? And I started doing ice baths with him when I would stay there. It was freaking wild.
It's great. I love
it. It felt
to do that
so
too,
good.
Yeah.
Oh my god. Turn. Good. All right, head back for me. Good, you're moving well here, man. Okay. Turn left hard. Turn right hard. That's it. Okay. Come back. Good. Turn right. Good. Now release it. Left. Easy. Good. Nice and loose. Let your body drop into the chair. I'm going to take you into lateral flexion. I'm going to rotate you. Your shoulder's going to drop. That's it. Good. Settle. Head back. Rotate right. Relax. So I'm just auditing what I just did. That's better. Loose. There, yeah, you're good there. Okay. Right there. Let it fall to me. Good. Perfect. Good. Yeah, nice. Okay, head back all the way. Chest up, head back. Good. All right, man.
Thank you very much.
You're welcome. Of course. Madison, we couldn't have done it without you. Nice work.
No problem.
Teamwork
no
here,
problem.
brother. All right, have a good one. Thanks so much for watching. And if you need any help, go check out those people. If we can help you out in this area, be happy to, obviously. And so I hope you learned something. I hope you take some advice in terms of just taking ownership of your health. Okay? Thank you.